Hi and welcome to this week's video. My name is Natalia Munoz and I'm an occupational therapy student. This week I had the opportunity of interviewing an OTR that has been working in the pediatric field for 12 years. She currently works at Patches PPEC, which is a prescribed pediatric extended care facility. This type of settings provide services for children from birth to 21 years old, and they receive nursing care, OT, speech, and physical therapy because they're not able to attend a typical daycare due to their diagnosis or health conditions. So the first question I asked her, what was it that she loved the most about being a pediatric OT? Her answer was that she loved seeing her patients become more independent, grow into themselves, and learn how to overcome obstacles. And obviously, being part of that journey is what she loves the most. Then I asked her what surprised her the most about being an OT. Well, to her surprise, pediatric therapy is physical and mental, and you require a lot of stamina to be able to engage with your patients. So one of her advices was to take time to yourself, implement an exercise routine, get a massage to work on achy tight muscles, and find an outlet to help you relax because it is very demanding. The third question I asked her was what has been the most challenging case she's ever had. Obviously, she's been working for 12 years, so you would know that she's seen many patients throughout this time. She's had different challenges. Every child is unique. Every client has their own way of learning, so it's a challenge in itself. But I would like to read what she wrote so that I don't take away from her story, which was very touching. And it says, I recently learned of the death of one of my first patients. This has been a big challenge for me currently, and more especially in regards to my purpose and faith. I have dealt with death in the past, but this one affected me the most. I started treating him when he was an adorable 1-year-old. He was born without a radius and a thumb on both upper extremities. But that didn't stop him from engaging in typical fine motor activities, and he has had one of the best handwriting samples in all of my career. He challenged my creativity to come up with adaptive equipment and modifications to allow him to be independent. Eventually, he went off to school, and I would get occasional updates of his progress from fellow peers. Then this week, I learned that he had developed leukemia and lost his life after a 10-month battle. I questioned my purpose as a therapist, wondering what was the point in working on all these skills if death was imminent. However, these feelings did not last, and I realized I was a positive influence in his life. I aided in him having independence and purpose. Not only that, but he taught me how to be a better therapist, and that I am eternally grateful for. As you can see, she created a bond with a child that only a therapist and a client can have. And it was a challenge for the child to be independent, but it was also a challenge for her to be able to teach him how to overcome his obstacles. And he became so independent. He was able to engage in school. And to me, it was very touching that this affected her this way. However, the important thing was that she was able to realize that she was a positive influence. Sometimes we don't know what life brings to us, but as a therapist, what matters the most is to be there in that moment and help our clients become independent and find joy and meaning in those occupations that they love the most. Another challenging cases that she has seen in her career has been with children that have low vision. And one of those cases was a child that have tactile sensitivity and aversion. And because a client that cannot use his eyes will use their hands, this child was very challenging because she had to look for other resources to help him become more independent. A lot of sensory interventions, a lot of modification, but as she said, nothing has been more rewarding than seeing them identify letters via Braille, figure out how to complete form board puzzles. So again, another challenge from a different client, but using that evidence-based research, the best practice approach, she was able to help the patients be independent and learn new skills. Now, when I asked her what was one of the myths about pediatric OT she would like to debunk, she says that a lot of times she hears, and this is on a regular basis, that being a pediatric therapist means that you play all day. Well, pediatric therapy is not for the faint of heart, as she says. And like she mentioned earlier, it's very physical, it's very mental, and it demands a lot from you as a therapist. Now, another thing that I asked her was what kind of advice she would provide for us now that we're going to start our level 1 field work. And she says that the major piece of advice that she would provide to us as students is to get every single opportunity to ask questions that we want to learn and that we don't understand, because we're going to be with skilled therapists for 12 weeks and we need to use this time to pick at their brains, to build our own therapeutic techniques, to learn from them and ask questions. However, she also mentioned that it was very important to be professional and to be mindful and take this opportunity as if it was a paid job, because the other therapists are also looking at your ethical behavior, your professional behavior, and your diligence. And who knows, maybe a position can open up later on and you can go back and work at this place, or you might need a reference letter. So this was an interesting activity. I really enjoyed reading and learning more about her experiences. One of the things that surprised me the most was how the death of the child, of a patient that she had not treated for so long, affected her personally and emotionally, because we're part of their lives. We're part of this journey, and we see them grow and become these children that are so independent, so passionate, and learn their way. And we are always walking with them, and we're always gonna have feelings for these patients that make us feel happy and grateful that we're part of that journey. So that was a surprise for me. I never thought it could touch a therapist in that sense. And last thing is, what do I find personally to be the most challenging part of being a pediatric OT? And I have to say, maybe trying to have the parents be part of that therapeutic activities that we're using, trying to get them to do carryover at home. A lot of times we tell them, oh yes, we're working on this, we're working on that, but they don't really understand why, what is the purpose of what we're doing. So I think that is the biggest challenge, getting the parents to understand what is the purpose of what we're doing in therapy so that they can carry over at home. And that's it for this week. Thank you for listening, and I hope you enjoyed this video.